Hey, everyone. Thank you very much to our speakers, and thank you to everyone who is participating in the chat and the questions. We do have a good chunk of time for questions. We're going to quarter after the hour, so we've got about 25 minutes. I will note that Ian needs to leave at 5 past the hour, so we're going to start with some questions for him, and please do put your questions in the Q&A. So Ian, I ended up having a bunch of questions for you, and I'm curious if there's anything that surprised you about when you were doing the evaluation or about this project.
I think every single time you can be surprised if you're open to new information and what it tells you, right? I mean, it's if you don't go with foregone conclusions, it's interesting where it will lead you. I think a few things that really jumped out at me, the needs of Indigenous people and Indigenous people using the space, and how their presentation of needs was slightly different from non-Indigenous people. The needs of women in particular, and focusing on their needs. The number of people who reported self-reported brain injury, I think, was quite illuminating in this space. And then the number of people where, through their own accounts, there seemed to be multiple health, mental health, and/or addiction issues going on concurrently, but they weren't connected to income supports in a way that would probably be most favorable for their specific presenting needs. And I saw all of these as opportunities coming out, an opportunity for the community to engage more deeply with like brain injury organizations and getting other medical assistance on site, more culturally appropriate supports and services on site for Indigenous people, and really having a gender-based lens to how we provide services going forward. I think we're like stuff that jumped out at me. And I'd also say people seem to really value being able to tell their story. And while they use a semi-structured interview guide, people had some very strong impressions that they shared outside of the questions on the importance of H4 in their lives, as particularly during the pandemic.
Yeah, I found that data really, really interesting. Ian, would you recommend that every community have a site such as this? And do you see any sort of pros and cons?
I think it really comes down to the community. And one of the things I really applaud the good folks of Windsor for doing is, early on in the pandemic, there was a very clear need. So it wasn't a guess. There was no place for people to go safely during daytime hours that would allow for physical distancing. And we were still talking about early days of the pandemic when it was cold and those sorts of things, and in the summer warm, et cetera. So is it for every community? No. Do I think there has to be 24-hour indoor access for people in communities? Yes, I think that is necessary. I also think different than some other service hubs that just look at co-location, one of the great advantages of Windsor is they started from a place of integration, not just co-location. So not just putting different resources on site, but from the very beginning, figuring out how those resources work together on site. And so I would never suggest to a community that they go the route of looking at a day service like this without an integration lens right from the very beginning, and have those partners truly partner in the spirit of serving people, not this is my mandate, that's your mandate, et cetera. And I also think you have to look at the need for a day service such as H4 in the context of what's happening in your shelter system and what's happening in your street outreach programs and services. It can be an asset to both of those other parts of the system if done well, or it can enter into a place which didn't thankfully happen in Windsor, where it becomes competitive across the three sectors of service. And rather than people collaborating in the space with shared consent, they throw up barriers and say, like, my client, my services, my information. Thankfully, with H4, it really was driven by end users and really end user centric from the very beginning of its design and service delivery.
Just to add to that, we've taken a philosophy change where it wasn't about organizations, it wasn't about mandate, it wasn't about stats for each individual, funded pace and where, who was responsible for what. It was really about the person and what the person needed and who could supply X, Y, and Z to meet those individual needs. And it's continued to be that way. Again, I don't care who comes in and provides health services. I just care that health services are on site and that people's needs are being met. I don't care if it's one organization or another organization, and the politics was really removed. And when I talk about politics, it's not about council's politics, it's about small p politics within the community. And we've kept people at the center of everything that we do and everything that we co-locate, so much so that agencies are coming to us. And I've been a big proponent for years to say, you know, the day that I can stop going out and asking for things and they just come because they've been recognized as being valued, that's when I know that we've instituted and we've created and implemented a really good program, because it's not for the sandwiches. People are not coming because H4 provides really great sandwiches. It's because the staff are valued, that they're seeing that they are being valued, that that they are getting their needs met in a way that hadn't been done before, quite honestly. And we had to be honest and authentic about that too. Like, there were things that we were doing really, really well, but there were other things that we were not doing well. And there was an unneed met by a population that was not accessing services. And we had to be very vulnerable and very honest about that. And that's hard to do. But we've remained committed to it. And, with Ian's feedback about the city maintaining leadership, we get told all the time, like, why are you going to that vaccine clinic? You've got staff to do that. You've got agencies to do it. A very good colleague of mine once said, the day that you lose, touch with what people need, you are doing a disservice. So go where the people are, listen to what the people are telling you that they need and that they want and how they want those services. Stop making assumptions. And we've continued to do that. So yeah, you know what, we'll go and sit in a vaccine clinic and talk to folks. And I'm not Kelly Foss from the city of Windsor. I'm just like, hey, I'm Kelly, how is this, helping you? What is missing? What do you need? And we've been nimble and have responded in real time and with urgency. This is all very urgent work. And, again, it's getting its credence where it's needed. So thank you to Ian for helping us, get to where we are and guiding us along the way and making sure that we're doing better for people and giving people the integrity and the respect that they deserve. So yeah, I don't know if anybody else has any questions or wants to add anything else.
That's a great point. Yeah, I'm monitoring the questions here. Ian, I know you're going to have to go shortly, but I'm wondering if you can just say, like, how do you ensure a one-stop of co-located services like this, remains a pathway for ending people's homelessness rather than like the only place they can get these services, so that it actually keeps them homeless or keeps them coming back to that service?
Yeah, I think this really comes down to passive versus active spaces and the objectives of the space. So when we think about one-stops or co-locating services or even drop-in services, day services, those sorts of things, I think in the evolution over time and based upon demands of specific communities, a lot of those have become passive places or are so grossly under-resourced in terms of staffing that they can only respond to the most urgent issue in the space at the time. What we saw in H4 was something different, not a passive space, but an active space. And what I mean by that is I saw a lot of staff engagement, intentional engagement with guests coming in, still respecting their space and autonomy, but checking in with people on their specific needs, following up with people on specific needs, making sure that there was conversations with regard to whether it was housing, healthcare, income supports, those sorts of things. I'm very active in that space and doing some really good follow-through work that I passively observed in the space when, you'd overhear conversations that were like hallway conversations between a staff member and a guest within H4 following up on a specific item. And so this idea of the intentional relationship being active and knowing what H4 was trying to achieve, which was to be another contributing entity to ending homelessness in Windsor. So it wasn't a passive space where we could say just to other organizations, hey, come and find your people here and do good things with them. It is when we have people here, we'll connect with them. And if they're already connected with you, fantastic. We will continue to facilitate that connection. And if they're not, then we can start the process right here and now and build traction towards whether it's getting on the by name list, documentation readiness, or moving forward with alternate safe and appropriate accommodation outside of the homelessness response system.
Thanks very much, Ian. Kelly and Miles, a question for you. A little bit of like, I think, a NIMBY question. How was the reception by residents around the center? Just given people's experience with like that can be a time when residents and others kind of come forward and start to complain about the space and the folks that are using that space. And it also sounded like you had a bit of a community engagement focus from one of the agencies. And so I'm just wondering if you can speak to all of that.
So if we look where Waterworld is actually sitting as a recreation center, it's outside a high concentration of social housing buildings. And that quadrant, or that 1 kilometer square area of social housing has a very high density of both 1-bedroom units, where the majority of folks coming off of our central wait list experiencing homelessness go and are unsupported to a certain extent. And then there's a section that is more family oriented with row houses and things like that. Waterworld abuts the family section, and for the longest time historically, the families had not been impacted by what had gone on across the quad over where the singles typically reside. And in that area is the highest density of 1-bedroom units in the city of Windsor, or within Essex County as a region. So, the climate of those different buildings kind of ebbs and flows depending on the tenants. For the first little bit, nobody knew what was going on at Waterworld. Again, we were at the beginning of the pandemic, things were being handled, that type of thing. As time went on, though, and particularly around the time that the largest shelter outbreak had happened, the folks who started going to H4 started to change. And that was because up until that time, staff had done a really good job of starting to house folks, get people on the by names list, and work that housing system the way that they should. But what ended up happening is that the depth of need of the folks that started coming to H4 had grown exponentially. And those were individuals that hadn't necessarily engaged prior to that. So yes, there was some NIMBY that has happened, and we've continued to work with the neighbors on that piece. And CUP, or Community Partnerships, is actually funded through our social policy department to provide community engagement to social housing developments that are at higher risk. So we've been working very closely with our police. They've done, community policing assessments around safety. We've been working with our bylaw enforcement department very closely around encampment processes and, encampment resolution and how to deal with outdoor sleeping. And again, trying to ensure that the needs of everybody are being met, and really having the conversation about, if not here, then where? Where is this going to, people need somewhere to go, whether it's a shelter or whether it's a drop-in program, whether it's social housing or not. These are still neighbors. They're neighbors experiencing homelessness. They deserve the right to be able to access services and supports to end their homelessness. And really, that's what the agency and that's what the program is really about. And it was about increasing visibility as well, because for the most part, staff were going in street clothes and, just doing their things. We're very intentional in March and April, and actually got t-shirts made for staff, and it says, how can I help you with housing? Like, listening to Ian all the time, it's always about the housing. Like, how can I help you? What do you need today? And once we started to increase the visibility of staff, and that staff were going out on regular walks to make sure that things like sharps were being picked up. There's a park right in front of Waterworld where children go and play. So, some of the activity that maybe was happening outside or in the general vicinity was not looked at positively. So, the staff now have 2 individuals, 1 or 2 staff that actually stay outside and engage with the people that are outside of Waterworld or outside of the H4 to ensure, again, that the neighbors are seeing that the needs of folks are being met, that if there is an overdose response that needs to happen, that it's happened, very, very quickly and very safely. Again, there's some folks that come to H4 because they feel very safe, but they don't actually walk through the doors for a lot of different reasons. So again, making sure that the needs of the people who come into the space are being met and with what they need, as well as for the folks that are outside that are coming there, but aren't interested necessarily in engaging in a very structured way. So again, being very intentional with the support agencies on staff and changing service delivery orientation. It's not about meeting somebody behind a desk with a computer. This is about going out and having a real conversation with somebody to say, hey, I see that you're limping. Like, what's going on? We've got a nurse here that comes today. Like, do you want to go talk to her? Do you want me to bring her out? And I would say that has been the biggest change for what we've seen, is that we've had to force folks to think differently about how to service a population who, comes in one day and they're mad and they're yelling and they're screaming, but it's not about get out of the building until you can have a rational conversation. It's about, what, Joe, it sounds like you're having a really hard time. Let's try to talk about it. Like, how can I help you? What do you need? What are you frustrated with? And that's where the staff have gotten the biggest kudos from participants, is because oftentimes they're escorted out of buildings. They're banned from going to different services. You have to do a checklist of things to be able to get needs met. And it's really about turning some more of those traditional models of support upside down and, and making folks think really differently.
Sorry, I got a split. Great answer, Kelly.
Thanks, Ian.
Thanks, Ian. Oh, Kelly, the questions are now pouring in here, and Miles. So one of them, I think I missed it. So have you moved to a new location yet, or are you sourcing a new location? Like, how do you see this continuing, and particularly the partnerships and the health partnerships? You could say some more about that.
For sure. So in July of 2021, we took a report to council and asked for council's endorsement to look at this as a longer term thing. Again, recognizing this is always just ever intended to be a COVID response, but there's value in it. So council gave us the authority to seek out professional services to actually start to think about a new space, a more permanent space, and envisioning what we call a housing hub, where not only would we have potentially this type of hub and spoke type service, but also having a range of housing or continuum of housing available. So whether that would be transitional units, permanent housing, a flexible community space to respond to, city, county, civic emergencies. Again, looking at it really as an integrated hub and continuing to work with our health partners and other non-homelessness serving agencies as to what their engagement is. I will say, in all of my almost 20-year career, we are talking with health more. We are looking at things like palliative care for this population and things that I could only ever have dreamed of. And again, it's not us necessarily going to them, it's us, being able to share the stories and talking about the data and talking about what we've seen and them responding appropriately. Again, I think the health sector does a really good job at servicing a population, but maybe, needs to think differently about how they service a population that, gets kind of turfed out of the ED or is seen to be drug seeking, and that's not the case. The staff at H4 have been successful in advocating for folks to have life-threatening or life-saving surgeries and actually getting the medical care that they need from hospitals. And that has spoken volumes, and we continue to use those stories to leverage and to advocate for what needs to change in the city and what needs to change between the systems and how they talk and how they try to integrate together. Again, so.
That's great. If you had it all to do over again, is there anything you would have done differently?
I think getting Indigenous services on site earlier. It was hard. We were in emergency mode at the beginning. That's hard. I don't know. I think we've done the best that we can. And I think that there were certain things that needed to happen along the way to get us to where we are. If it wasn't for the shelter outbreak and having leadership be on the front line a little bit, honestly, I think that was a pivotal change for us. Maybe getting Miles to implement HIFIS a little bit sooner.
Yeah, I was just going to say that was, if we had that 3 months before, it would have just changed our data perception. All of even the housing move-ins, like we were dealing with so many different streams of information coming in from so many different sites that it was often a very confusing data picture we were trying to gather each day of who was staying where and who was getting housed and who was helping and who was supporting. And I think having HIFIS implemented maybe like a day before that shelter outbreak would have just been a pivotal moment for us. So it's out there now, which is a really positive thing. And hopefully we can continue to build on that momentum.
And Kelly, what difference do you think it made? Oh, I'm just like blanking on my question a little bit. Oh my gosh.
From a service user perspective?
Yeah, I guess, how did it sort of impact the rest of your system? Because you do one thing in a system, it kind of has ripple effects. Oh, I was also going to ask, like, how important was it that you had a common consent in place? Because when you brought all those folks co-located into a location, like Ian was saying, like, oh, I can't share that information, I can't talk. Like, I don't know how some of your earlier work also really helped when you implemented this space.
A lot of what we had done was really about common consent and sharing. And to be completely honest, when we started the facility, it was kind of run with a hippie lens. It was, kind of like, what do you need? How do you need it? And how can we remove as much bureaucracy to ensure that the needs of people are being met? We had already established a common consent for a by names list. So we were using that heavily. We had been doing a ton of work on HIPAA around shared consent. So then, we started looking at that. Actually, we're looking at rolling out a shared consent around life stabilization areas through work with our Ontario Works office that covers any life section and will include almost every sector that the population would interface with. And those are huge wins for us to be able to eliminate the red tape that folks have to try to navigate through and having to sign a consent with every organization in order to get their needs met. So really, again, as long as we're keeping people at the center of this, it's helping make reducing barriers and it's helped all the way around. Sorry, Marie, I can't remember the second part of your question.
That's okay, me neither. Yeah. Has it made an impact on sort of outdoor sleeping? Because lots of communities are having a lot of encampments and outdoors. Like, how has opening this center had an impact on that?
It's ebbed and flowed. We've had encampments show up outside of H4. We've had to take a really hard line about what does that mean and why are folks not going to shelter? And again, having really hard conversations about why that is. Like, why are people, setting up things and bringing all kinds of items? But again, recognizing too that it is legitimately a chain link fence in 10 feet from a family unit. So what were those kids seeing in the evenings when staff were not on site, and the risk that it was posing some of those families that are very vulnerable. And again, trying to find a balance to that and having to almost take a bit of an enforcement approach to it. But again, in tandem with our outreach workers and being very mindful of the needs of folks as well, to try to find out, where could they go if not an emergency shelter, were their friends, families, other things, and talking about, what was stopping them from getting into housing. And how could we remove some of those housing barriers and really be intentional about trying to move somebody off the street, literally, into a housing unit? And what was it going to take?
That's great. And you had 1 month, I think, where you had like 54 people move into housing. Like, just this real high point. And that was a lot, I'm hearing, to do with your center and the work that was happening there.
Yeah, and just the urgency and everything just kind of started to come together after February, March. I think the kinks of understanding that housing was possible, and we saw a ripple effect. Like, once we started, once staff started housing a couple of people, it was like, oh, how can I get housed too? Like, what is it going to take for me to get housing? Like, you're housing John. Mm-hmm. So because to a certain extent, what we were hearing from folks was that, oh, I've been told, I can't get housing. I've been told I'm unhousable. And that is horrific. Nobody is unhousable. So if a system has created that mindset, or staff had to work 10 times harder to prove to folks that you are housable. Like, we are here to help you and support you to get housing. What do you need? Do you need income? Do you need ID? Do you need us to check to make sure that your centralized waitlist application is actually still active? You applied 5 years ago, but you haven't received anything. So it was really forcing staff to understand differently about why somebody would think that, you know, and really trying to understand things from a very different perspective.
Yeah, that is great. You know, Kelly, thank you for sharing that model, and Miles, for talking to us about your approach, and for everyone who participated and asked questions. And I know it looks like there's some other folks from Windsor on the line who are sharing their experiences with this approach as well. So thank you to all of you. I do want to remind you to complete the session evaluation that's located under the video player beside the discussion tab. And just to remind you that Tanya Talegda's keynote presentation will begin in about 15 minutes at 1/2 the hour. And again, just really want to thank everyone for your time in this session. Hope you have a great rest of your conference.
Thanks, everybody.
Bye now.